Hello, everyone, and welcome to our question lab this evening. This evening's topic is endocrine pharmacology, and we're lucky to have Boris leading our discussion again today, and Boris is going to introduce himself now.
Thank you, Sean. Hey guys, my name is Paris. I am a dermatology resident at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school, then went back home to Michigan to do medical school. Now work as a dermatology resident, and I'm also working for USMLE-Rx as an RX coach. Work one-on-one with students to help prepare them for the USMLE Step 1 and Step 2 CK as well.
As you can see with our first question here, the answer choices are covered up, and that is by design. We cover up those answer choices because we do not want them to guide or dictate your thought process, and we don't want you to see an answer choice that you might be unfamiliar with, which may cause you to panic as you're trying to answer the question. So I've gone ahead and removed those answer choices for you here this evening. After that, we'd like to read the lead-in. And we read the lead-in first because by reading the lead-in first, you're able to know what the test writer is asking or what the question writer is asking. And that allows you to pick out all the relevant clues in the vignette without having to reread it, which should hopefully save you time and keep you focused as you're reading the question. So we will go ahead and read the lead-in now. And the lead-in is the last sentence or the question itself. Which of the following medications is most likely causing this patient's symptoms? Which of the following medications is most likely causing this patient's symptoms? After that, we'd like to ask our students how many steps they believe this question will require. And the reason we do that is because we want you to have an organized thought process to make sure that you're not getting tripped up on test day and that you are, in fact, employing all the right steps to get to the correct answer to the correct question. So I'll give all of you a few moments here to let us know in the question box how many steps you think this question will require. An example of a one-step question could be where they ask you, what is the diagnosis? An example of a two-step question could be where they ask you, what is the treatment for a diagnosis? And an example of a three-step question could be where they ask you, what is the mechanism of action of a treatment for a diagnosis? I see our responses coming in, so we'll go ahead now and read the vignette. Now, in our coaching sessions, the coach will stop you after every sentence to ask you what you believe is important, what you want to highlight, what you're thinking, what your train of thought is like. We can't do that with all of you individually today, so I'll pause briefly after every sentence so you can gather your thoughts. Here we go. A 35-year-old woman with a history of type 2 diabetes mellitus, hypertension, and hyperlipidemia presents to the emergency department after multiple episodes of vomiting. She states that she experienced 3 episodes of non-bloody and non-bilious vomiting after a late night out at the bar with her friends. She is oriented, follows commands, and answers all questions appropriately. On physical examination, the patient's face is flushed and her heart rate is 110 per minute. Her abdomen is non-tender, without guarding or rebound. Neurologic examination results and gait are normal. She reports good compliance with her medications for her diabetes, hypertension, and hyperlipidemia. Which of the following medications is most likely causing this patient's symptoms? I want all of you to start thinking about the important and relevant clues in this vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So what we'll do is we'll go ahead and show you what we think are the important clues in this vignette and the lead-in. And so starting off with the vignette, we'll show you what we think are the important clues there. So with this vignette, the first thing that's usually given to you and that's important is the demographics. So 35-year-old woman. So that's going to be important in this question, and that kind of helps narrow down what you should be thinking in terms of diagnoses. That kind of gives you a general sense of where you should be thinking. So demographics is first. And then past medical history. They give us here that she has some of the more chronic medical conditions, diabetes, hypertension, hyperlipidemia. We know why she came to the emergency room, and that's important. They also give us some descriptors about the vomiting, so that's going to be important. They gave us some potential associations as well. And then they give us some physical exam findings. You know, she's able to follow command. She answers all questions. Her belly is non-tender. Her neuro exam is normal. All additional clues that can help us cross off or narrow in on a diagnosis. We also know that she's having some skin issues, and they give us that she's taking good compliance with her medications. So then they ask us lastly, which medication is likely causing this patient's symptoms? So in terms of how many steps is this question, I think one, we need to figure out what's going on with this patient. Maybe what's the diagnosis, what's going on with her. And then two, what medication could maybe be causing that? So maybe a two-step question here. So let's go ahead and take a look at those answer choices. And as you can see there, we have 5 answer choices. And what we're going to do is we recommend that students, when going through answer choices, that they start at the bottom and they work their way up. So in this case, starting from answer choice E and working their way up to A. And the reason we do this is because a lot of times we'll see students, they'll start at the top, they'll see something they like, and then they'll select it. And then they won't have gone through all the answer choices. So this way, it prevents you from biasing yourself and makes sure that you get through all the answer choices. So we'll do that now. Answer choice E, metformin. D, lovastatin. C, pramlintide. B, chloropropamide. And A, hydrochlorothiazide. So we're going to go ahead and open up that poll. Go ahead and select the answer choice or the medication you think is most likely causing this patient's symptoms, and we'll talk about it in just a few seconds.
Excellent. One of the things that we do want to stress to all of you is it's important to not jump ahead, right? We have certain steps in place for a reason, and that's one way to approach questions, but you could have your own method as well. But we encourage you to really take all of the steps and not rush to try to answer a question like I saw some of you doing in the question box. It's not a competition. Your goal is to get the question right and get as many right as possible, okay? So we'll give all of you a moment here to answer this question. Keep in mind that there is no penalty for guessing on test day, so never leave a question blank. And there certainly is no penalty for guessing tonight. So even if you're unsure, take your best guess, and then we'll talk about the correct answer and why it's correct, and the incorrect answers and why they're incorrect in here in just a moment. All right, let's take a look and see. Let's take a look at what you selected. It looks like there was a clear favorite, and it looks like 35% of you selected chloropropamide. In second place, almost tied with third place, was pramlintide and metformin. So let's take a look and see what the correct answer is, and the correct answer is, in fact, B. So well done to all of you who got it right. It was a challenging question, but let's make sure you got it right for the right reasons. And if you got it wrong, don't worry. It's a learning process. Listen to Paris now, and you'll nail it on test day. Paris.
Thank you, Sean. Good job, guys. So this is a nice question. So this woman, they gave us a couple interesting clues in the question. One, they said this started after a late night out at the bar. And then two, they also said that she has good compliance with her medications. Those are things that you don't normally get in questions. So they gave us a couple interesting clues there. She's presenting with vomiting, flushing, and tachycardia. And this is probably after alcohol intake, which is what they were getting at with the late night out at the bar. So this is probably what we would call a disulfiram-like reaction. So these reactions occur when a medication inhibits alcohol metabolism in the liver, and then you get accumulation of acetaldehyde, okay? You can have this happen intentionally to help prevent people from drinking alcohol, and it can also even be a side effect unintentionally from medications, which is the case in this question. So this patient we know has a history of type 2 diabetes, and we know she's compliant with her medications, so the likely culprit here would be answer choice B, chloropropamide. It's a first-generation sulfonylurea and is known to be associated with these types of reactions, these disulfiram-like reactions. Okay. Looking at the other options, answer choice E, that is not associated with the disulfiram-like reaction. You could be thinking instead about lactic acidosis. D, lovastatin or statins. These usually are associated with liver toxicity and myopathy. Answer choice C, The side effects from this would include nausea, vomiting, even hypoglycemia. And then answer choice A would be hydrochlorothiazide, which can be associated with electrolyte abnormalities. You might be thinking potentially, is this hypoglycemia with a fast heart rate and flushing, which is a good thought. However, we know that she's in good compliance with her medications, and this hasn't happened before. And this also happened specifically after a late night out drinking. So probably the best answer choice would be B. On the next slide, we actually have a couple tables that show specifically where in first aid it talks about first generation sulfonylureas having disulfiram-like reactions. Okay, they're not as commonly used in clinical practice anymore, but if you still can get tested on some of those side effects that are notable. And on the next slide as well, we actually have another table in first aid talking about the disulfiram-like reactions. There are a few medications, sulfonylureas, procarbazine, cephalosporins, griseofulvin, metronidazole. Okay, so these are agents that can lead to disulfiram-like reactions if taken and one consumes alcohol on them. Okay, so great job with this question. We'll move on to question number 2.
Great job, everyone. It was a challenging question. I saw a lot of you in the question box on the right track. Let's move on now to our second question of the evening. Once again, our answer choices are covered up. That is by design, like I said. Now we're going to go ahead and begin by reading the lead-in. The physician is referring to supplementation with which of the following vitamins? The physician is referring to supplementation with which of the following vitamins? I'll give all of you a moment to let us know in the question box how many steps you think this question will require, and then we will read the vignette. All right, I see the responses coming in. Let's read that vignette. A 16-year-old girl presents to her pediatrician concerned about a blotchy facial rash across her cheekbones and the bridge of her nose. Physical examination reveals the rash to be red with sharp edges and a blotchy appearance. Discoid rashes are also found on her scalp. Further testing indicates she is photosensitive, and nephrotic syndrome is also diagnosed. The patient is prescribed an appropriate medication. However, during her follow-up visit, she expresses concern about developing facial puffiness and weight gain since she started taking the medication. The physician addresses her concerns and states that he may give her a vitamin supplement to prevent another adverse effect of this medication, which may develop with long-term use. The physician is referring to supplementation with which of the following vitamins? As always, we want you to start thinking about the important clues in the vignette as I hand it off to Paris.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in that vignette and the lead-in. So with this question, we actually have a pediatric patient, so 16-year-old girl. So that's going to be important here, okay? They also give us some cutaneous or some skin findings that she presents with, okay? And we kind of highlighted all of those. We also know that then the patient is prescribed a medication, okay? She then develops some things that are concerning to her, and then the physician gives her a vitamin supplement, okay? These are all important things in the vignette because it's kind of leading you along a certain direction, but it's also telling you chronologically what happened because there are 2 visits here taking place in this one vignette. So it's important to keep that in mind, okay? So then in terms of the lead-in, what's important is, what's that physician getting at? What supplementation, what vitamin supplementation is he or she talking about? So what we're going to do is we're going to move on to how many steps is this question. And I think first, I think we need to figure out what's going on with her. And then, so that would be step number 1, what's going on, what's the disease, what's the condition. And then step number 2, maybe what was prescribed to her. They said that she was prescribed an appropriate medication. So what was that medication that was prescribed? And then 3, maybe what is a vitamin supplement, or actually, I would say this could even be a 4-step question. So the third step is what's another side effect of this medication? And then 4, what's a vitamin supplement that can help prevent that adverse effect? So once again, 1, what's her condition? 2, what was prescribed for her? 3, what's another side effect of this medication? And 4, what's a vitamin supplement that can help prevent that? So we have a few steps, a few things that we need to answer. So let's take a look at those answer choices. Answer choice E, vitamin K, D, vitamin E, C, vitamin D, B, vitamin C, and A, vitamin A. So we'll go ahead and open up that poll. Got a few steps here to think about, and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
So if you guys don't mind, please let us know in the question box. I accidentally clicked that button twice and closed the poll. My apologies. So I'll give all of you a few seconds here to let us know in the question box what you believe the correct answer is. A, B, C, D, or E. I'll give all of you a few seconds here and then we'll see what the correct answer is. All right, I see the responses coming in. I'll give you a few more seconds. All right, remember there is no penalty for guessing on test day, so take your best shot, and then we will go over the correct and incorrect answer choices. All right, well, let's see what the correct answer is. And the correct answer is C, vitamin D, and I see a lot of you were picking that. And we'll have Faris explain to us why that is the correct answer now. Faris.
Thank you, Sean. Yep, great job, guys. So let's look at this vignette again. So we've got a few steps to answer. 1, what does this patient have? Well, they're telling us that she's got a facial rash along the cheekbones and the bridge of her nose. Okay, that's probably, when we look at all the other things, that's probably getting at a malar rash. Okay, we also know that she's got discoid rashes on the scalp, so discoid lupus as well. Okay, and then she has photosensitivity, and then she also has kidney issues. So she has a lot of the criteria for diagnosing systemic lupus. So she probably has SLE or systemic lupus. So that's answer number 1. Step number 2, prescribed an appropriate medication. Well, when you see that she then develops facial puffiness and weight gain, you should be thinking about steroids. So she may have been prescribed corticosteroids to help treat her lupus. And steroids are commonly used to help treat acute lupus, especially in the setting of nephrotic syndrome or nephritic syndrome of lupus. Okay. So what is another adverse effect of this medication? Well, I think what they're getting at there is osteoporosis. And you can prevent that with taking vitamin D supplementation and calcium, and sometimes, if needed, even bisphosphonate therapy down the road. So the adverse effect that can be prevented with a vitamin would be osteoporosis and supplemented with vitamin D. Okay. Looking at the other answer choices, you can see there that vitamin K, that can sometimes be associated with the use of warfarin, vitamin K deficiency, but that's not what's going on in this patient. Vitamin E deficiency might be seen in some conditions associated with fat malabsorption, like pancreas issues, but it's not commonly associated with the use of any medication. Vitamin C deficiency, usually caused by low intake or uptake. Lastly, vitamin A, that's not commonly associated with the use of any medication. So the most appropriate answer would be vitamin D. And if we take a look at the next slide, what we see there are some of the side effects of MSK type reactions to medications. And we can see under osteoporosis, actually the first one listed there is corticosteroids. So you can see that. And then on the next slide, we actually have another thing about adverse effects of steroids, and you can see there under MSK, osteoporosis is another side effect of corticosteroids. So these side effects of steroids are very important to know. They're oftentimes questions on step 1, so make sure you understand how they present and are able to diagnose them.
Excellent. Great job, everyone. You know, another challenging question, but hopefully Paras' explanation will help you master this material. You know, we spoke about RX Coach earlier, and you met Paras and you met Alec. You know, RX Coach is our one-on-one tutoring and coaching program. And we work with students individually to help them identify their strengths and weaknesses, create a personalized study plan, and then implement that study plan in a way that helps us bridge knowledge gaps, work on content issues, as well as test taking skills. You know, there are lots of different ways to study for the USMLE, but what worked for your friend or worked for one of your classmates may not necessarily work for you. And by taking advice from your colleagues or finding information online, you know, it may very well be good information, but it may not be applicable to you. Our students always tell us that by working with us one-on-one, they were able to be more efficient in their studying, get to what they wanted to be in a quicker amount of time, but also to accomplish their goals. Once again, you know, studying for the USMLE and while you're in medical school can be challenging. And so we have lots of students who actually use us in medical school and then also for their comp and also for the USMLE or for the COMLEX. Because keep in mind that our sessions, once you subscribe to RX Coach, they never expire, so you're able to use them at your convenience. And we've had a lot of success with the program. And as you saw, you know, we have one derm resident with us today, another future osteopathic doc with us, or sorry, orthopedic with us. So it's a program that has been successful, and the people that help students like you and our coaches are very well qualified and highly trained. So if you want that expert guidance while you're trying to navigate through medical school or through your comp or through your USMLE, you know, reach out to us. There's a reason why we have a 4.9 out of 5 student satisfaction rating, right? And you can reach us at rx-coach or rx-coach.com. You can click on the free consultation tab to book a free consultation with me, and we'll talk about the program and how it can benefit you. You can also click on the pricing tab to see the different packages we have available. And when you schedule that consultation, I'll tell you about the promotion that we're running now. So once again, that's rx-coach.com, and you can schedule a free consultation to discuss the program. As always, if you want access to free study advice or tips with some of our coaches or blogs or even a free study planner, you can find that information at firstaidteam.com. So we're halfway through. We've got 2 questions down. We've got 2 left. Let's try to finish strong. Keep in mind that we do have a raffle at the end, and you must be present to win. We also have a very special offer for those of you in attendance. Okay, so let's move on now to our 3rd question. Once again, the answer choices are covered up, and we will begin with the leading. Which of the following medications is most likely responsible for this patient's reaction? Which of the following medications is most likely responsible for this patient's reactions? I'll give all of you a moment here to let us know in the question box how many steps you believe this question will require. And then we'll read the vignette. All right, I see some responses coming in, so let's go ahead and read that vignette. A 43-year-old woman presents to the emergency department complaining of severe headache, blurry vision, and shortness of breath. She says she had been enjoying her evening at a cocktail party when the symptoms began. She first felt dizzy and then began vomiting profusely. Review of symptoms is significant for facial flushing. She reports that she had never developed such symptoms before. Past medical history is significant for type 2 diabetes mellitus. Her blood pressure is 86/58. Heart rate is 115. Respiratory rate is 22. Her physician suspects a reaction to a new medication. Which of the following medications is most likely responsible for this patient's reaction? And with that, I'll hand it off to Paras.
Thank you, Sean. So once again, we'll kind of go ahead and show you what we think are the important clues in the vignette and the lead-in. So again, demographics, this is a 43-year-old woman coming in with headache, blurry vision, and shortness of breath. And again, some interesting clues there. Enjoying her evening at a cocktail party when the symptoms began. Whenever they give you something interesting like that, it's always important to make note of it, and oftentimes important to answering the question as well. They give us some more signs and symptoms. They give us some vital signs, some medical history. And then lastly, and most importantly, they say that the physician suspects a reaction to a new medication. Okay, so looking at this lead-in, which medication is most likely responsible for the reaction? I think one, we need to figure out what's going on in this patient, what's this reaction? And then two, which medication can cause that reaction? So a nice two-step question here. So let's take a look at those answer choices. And once again, we will start at the bottom and we'll work our way up. Answer choice E, tolbutamide. D, sitagliptin. C, pioglitazone. B, metformin. And lastly, A, glipizide. So we'll go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. Let's see how many of you get this one right. I feel like we'll have a strong performance. We'll give all of you a few moments here to submit your responses, and then as always, we'll go over the correct and incorrect answer choices. You know, when you're doing questions on your own, it's important to not just read the answer of the explanation for the correct answer, but to actually read all of the explanations. And if you have been in QMax lately, using some of our new questions, you'll see that we actually have a new format of explanations where we actually explain the explanation step by step, kind of like Paras is doing now. So it's a very interesting feature, very helpful feature, and we have gotten rave reviews as a result. So for those of you who have not yet experienced that, some of our questions are updated, and Jeff will talk about that later, and more are coming soon. All right, let's take a look and see what you selected. I see that a lot of you paid attention to the first question. So we're all learning together. All right, and it looks like 55% of you selected tolbutamide. So let's see what the correct answer is. And the correct answer is indeed tolbutamide, so well done, everybody. I'll hand it off to Paras.
Thank you, Sean. Great job, guys, again. So let's take a look at what's going on in this patient. So again, this patient is presenting with headache, blurry vision, and vomiting, as well as facial flushing after drinking. Okay, so likely, again, a disulfiram-like reaction. It's oftentimes disulfiram is a medication, and we talked about this earlier, that can actually be used in recovering alcoholics or people trying to avoid alcohol to help prevent relapse. Because if you drink alcohol while taking it, it leads to the formation of acetaldehyde, and then this accumulation leads to unpleasant effects such as nausea, vomiting, and headache. So it helps forces people to not drink when they're on this. You can get these types of reactions called disulfiram-like reactions with other medications, okay? And this patient is likely taking an oral hypoglycemic agent for her diabetes, okay? All of these medications are used to treat diabetes, and they, are ones that she theoretically could be taking. However, the only one there that's known to cause a disulfiram-like reaction is answer choice E, tolbutamide, okay? Sitagliptin or DPP-4 inhibitors are generally well tolerated and not associated with that kind of reaction. Pioglitazone, that can cause weight gain, hepatotoxicity, and issues in patients with heart failure, but not associated with the disulfiram-like reaction. Metformin, we talked about in the first question, how that's more associated with lactic acidosis. And glipizide, which is a second generation sulfonylurea at risk for weight gain and hypoglycemia. And also important to differentiate hypoglycemia from this reaction, which started after enjoying a night out. So let's take a look. And I think, we previously had touched on the same medication. So just to keep in mind, that those same medications that can cause disulfiram-like reactions are first-generation sulfonylureas, certain cephalosporins, metronidazole, griseofulvin, and procarbazine. Okay, So the best answer choice here is tolbutamide, which would fall under the category of first generation medication. So nice job here with these questions, and we have one question left.
Excellent, thank you, Paras. You know, we did a very similar question at the beginning of this evening's question lab, and 32% of you got it right. And then we asked a very, very similar question, same class of drug, and then 55% of you got it right. So 23% more of you got it right within a matter of minutes, right? And that's because the methodology that we use and the way Paras and our coaches teach you does really work. So if we can make that improvement in just a matter of minutes, imagine what we can do when you work with us long-term as individually with an RX coach as opposed to in a group setting. So if you are interested in working with us and you see the results for yourselves with a lot of our students, probably some of your colleagues, reach out to us at rx-coach.com or rx-coach.com and set up a free consultation. So, and we can all talk about how we can help you, all right? One question left, and then of course we have our raffle and our special offer. You must be present to win. Let's try to finish strong. Once again, the answer choices are covered up and we will begin with the lead-in. Which agent is most likely responsible for this patient's presentation? Which agent is most likely responsible for this patient's presentation? I'll give all of you a few moments to let us know in the question box how many steps you believe this question will require. We see a nice little comment here with, thank you for the new way of doing the questions on BRICS and QMAX. My life has changed because of this. Thank you so much. Well, you're very welcome, and thank you for using our products and services. With that, let's go ahead and read that vignette. A 30-year-old man comes to the emergency department after collapsing at work. His coworker who accompanied him said that the patient became confused and agitated at work prior to collapsing. The patient has a past medical history of type 1 diabetes mellitus and recurrent migraines for which he takes medication for daily. While in the emergency department, the patient is conscious but remains confused. The patient appears pale and sweaty. His temperature is 98.2 degrees Fahrenheit or 36.7 Celsius. Blood pressure is 104/60 and pulse is 80 per minute. Respiratory rate is 14 per minute and pulse oximetry is 94% on room air. The patient's laboratory values are as follows: sodium 136, chloride 99, BUN 16, potassium 4.1, bicarb 24, creatinine 0.9, and glucose 32. Which agent is most likely responsible for this patient's presentation? I want all of you to start thinking about the important and relevant clues in this vignette as I hand it off to Paras.
Thank you, Sean. So once again, we'll go ahead and show you what we think are the important clues in this vignette and the lead-in. And hopefully you guys are learning from us doing this, what we think are really important, relevant clues to highlight, and what maybe are not as important and don't need highlighting. So that when you go back and look at the question, you look at the vignette, you've kind of highlighted the relevant information and it can save time that way, okay? So hopefully by us doing 4 questions together and showing you what we think is important, you're able to pick up on some of those clues as well, okay? So again, demographics, this is a 30-year-old man who collapsed at work. They give us some information about what happened prior to him collapsing, his medical history, some of his medications, physical exam findings, and then also they give us some lab values, okay? And it's important to go through those. Take a look at the normal lab values if you need to, figure out what's normal, what's abnormal, and then lastly, then they're asking us which agent is responsible for the presentation. In terms of how many steps do we think this question is, I think 1, we need to figure out exactly what's going on with this patient. What is this presentation? And then maybe 2, what drug is responsible for that presentation? So maybe a 2-step question here. So let's take a look at those answer choices and see what we're working with. And once again, we have 5 answer choices, and I'm going to start at the bottom again and work my way up. Answer choice E, verapamil, D, topiramate, C, sumatriptan, B, propranolol, and A, amitriptyline. So we'll go ahead and open up that poll. Go ahead and select the answer you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Parth. This is our last question. Let's try to finish strong. I see a comment. Question 4 is a beautiful clinical scenario. So thank you for that comment. Another comment here, first time and I'm already loving it. So we do these question labs every Tuesday at 8 p.m. So you're welcome to join us every week. And do us a favor, please tell your friends and colleagues about us. We'd love to help as many people as possible. We'll wait until about 2/3 of you have responded, and then we'll go over the correct and incorrect answers, and then we'll move on to our raffle and our special offer. I see the responses coming in. We'll give all of you a few more seconds. All right, almost there. Well, let's take a look and see what all of you selected. Looks like the favorite here with 43% of you selecting was answer choice B, propranolol. So let's see if that's the correct answer. And the correct answer is in fact B, propranolol. So great job, everybody. Another tough question. I'll hand it off to Paris for the explanation.
Thank you, Sean. Great job, guys. Definitely a tough question and definitely a very good clinical question. So what's going on? Well, this patient has type 1 diabetes and is presenting with hypoglycemia. We can see that glucose is 32. However, he doesn't have the typical warning symptoms that a lot of patients do. He kind of just collapsed, okay? We do know that this patient was started on a medication to treat migraines, okay? So this medication may have delayed his awareness of the hypoglycemia and this compromised his ability to correct it in a timely fashion. So hypoglycemia, commonly occurs in patients taking either insulin or insulin secretagogues like sulfonylureas. And hypoglycemia is usually more frequent in type 1 diabetes, okay? So patients with hypoglycemia, they can present with a variety of symptoms, okay? Fine tremor, palpitations, anxiety, cold sweats. They can also present with different types of symptoms as well, such as weakness, confusion, drowsiness, syncope, which is the ones that this patient had, confusion and syncope, okay? So it's important to recognize these symptoms as a sign of hypoglycemia so you can correct it quickly. In this situation, the patient didn't have those typical symptoms of palpitations, tremor, sweats, and that's probably because it was masked, and this is probably because the patient was taking a beta blocker or propranolol. And all beta blockers can mask those neurogenic symptoms of hypoglycemia because you're blocking the catecholamine response that usually causes those signs of hypoglycemia. So this results in what we call hypoglycemic unawareness. The patient is unaware that they are hypoglycemic until they either get confused or have syncope, which is what we have in this patient. So it's important also to know that beta blockers are one of the first-line drugs used for migraine prophylaxis, okay? So none of the other medications are associated with masking this patient's warning signs. So let's take a look at the next slide. And actually on this slide, we can see here that beta blockers in the adverse effects there, you can see that the second sentence or the second line there say may mask the signs of hypoglycemia, okay? And furthermore, on the next slide, looking at hypoglycemia in diabetes mellitus, you can see there, I believe on the next slide, there's another table talking about diabetes mellitus. you can see there that some of those neurogenic symptoms that are mediated by catecholamine get inhibited or blocked by beta blockers. So that very last row, hypoglycemic unawareness, the masking of hypoglycemic symptoms. It occurs due to beta blockers, okay? And it masks those neurogenic symptoms such as palpitations, anxiety, tremor, but the neuroglycopenic symptoms are intact. So confusion, syncope, blurry vision, which is what actually was happening in our patient, okay? So let's go back to the vignette and let's go back to the other answer choices. Hopefully you'll now be able to pick up on why propranolol was the best answer. Let's also talk about the other answer choices. So verapamil, these can be used as second-line agents to prevent migraines, but they're not associated with the patient's side effects. The main side effects of verapamil would be peripheral edema, constipation, dizziness. With topiramate, that's an anticonvulsant which can also be used to prevent migraine headaches, and that can cause tiredness, drowsiness, dizziness. And it's also, however, it's not associated with this patient's lab abnormalities and doesn't block those neurogenic symptoms of hypoglycemia, so also not correct. Sumatriptan, these are indicated for the acute, for treatment of acute migraines, and can cause more cardiovascular issues. Again, not associated with blocking those signs of hypoglycemia. And lastly, amitriptyline. This is a tricyclic antidepressant that can be used for acute migraines. Migraine prophylaxis. And it's highly sedating. It can cause weight gain. It can have some anticholinergic side effects as well. But it, again, is not associated with what's going on with this patient and blocking those catecholamine-induced signs of hypoglycemia. So the best answer here is propranolol after picking up on the fact that this patient was having hypoglycemia, but it was just the patient was unaware because of the propranolol. So great job today, guys. Some nice endocrine pharmacology questions, and I will hand it back to you, Sean.
Excellent. Thank you, Parlos. Yes, absolutely. Great job, everyone. We did some challenging questions together. And now I want to share with you one of our bricks. So we're on endocrine, and MEN is one of those highly tested topics, and sometimes it gives students problems. So I want to share with you a brick on multiple endocrine neoplasia. As you can see, each brick starts off with learning objectives, right? So these are the 4 learning objectives that we're trying to accomplish here with this brick and what you should walk away learning. Estimated time to complete this brick is approximately 12 minutes. We begin with the case connection to bring this material to life. And so we start with this case connection, and then we'll tie it back together with the case connection here at the end. So we start with MEN, right? So we talk about that, and you have wonderful images here, flashcards here as well. And as you continue in this learning module, you'll notice that it's very visual, right? It flows very well, but it's also very conversational. It's not formal like a textbook, right? And that's very intentional. You even have these interactive images where you can cover up and hit the quiz button and then try to select the correct answers to make sure that you know exactly what that image is trying to teach you and show you. So you see here clinical presentation, mnemonics as well, genetics, and we keep going down. And as we continue with this interactive module, we'll eventually get to more images. And as we get to the end, you'll see here, we'll tie it back to the original case connection, right? Then you have a summary of the take-home points that we really want you to take away from this brick. And we also have practice questions, so you can test yourself. And once you get the answer right, you'll see the explanation, right? And then you can review your learning objectives, see which ones you're confident with. And then this part allows you to stay really organized. You can go directly into first aid, you can go directly into flashbacks, you can go into express videos, or you can practice with QMAX. So if I hit this button, it'll take me directly to that part in first aid 2021, which, as you can see, has now been upgraded or updated to first aid 2021. And then from here also, you can go into express videos, QMAX, or flashbacks. So it's a really nice tool. It helps you stay organized, prevents you from having to break up your thought process, flipping between resources. So for those of you who haven't really explored bricks or our digital platform yet, I highly encourage you to do that. Okay, we have a free trial. And even when that free trial expires, you'll still have access to 150 bricks completely free of charge. So there's absolutely no reason why you should not experience it for yourselves. So with that, let me go ahead and go back to the PowerPoint and share with you our question IDs from this evening. So these QID numbers, if you have access to QMax already, you can simply copy and paste these QIDs into the RX search field, okay, and review these questions on your own time. So I'll give you a moment here to either take a screenshot of it, take a picture of it, or write these numbers down.